Lots of people question why their physicians, their obstetricians, tell them during pregnancy to avoid certain foods. That's because of the risk of foodborne illness. We know that during pregnancy, the immune system is weakened, and pregnant women and their unborn child have an increased susceptibility to and an increased severity of certain foodborne illnesses. Listeria infection is 18 times more common in pregnant women than in the general population. This infection during pregnancy is associated with an increased risk of miscarriage and stillbirth, and the infection can be transmitted to the fetus, causing meningitis and serious blood infections. About 1/3 of fetuses with Listeria infection do not survive. So the bacteria are commonly found in unpasteurized milk, soft cheeses, and uncooked hot dogs and lunch meats. Toxoplasmosis is the second foodborne illness that's of concern for pregnant women. It's an infection caused by a parasite. And if pregnant women become infected, there's about a 40% chance that she'll pass this infection to her unborn baby. Infected babies may develop vision and hearing loss, intellectual disabilities or seizures, and some die within a few days of birth. The toxoplasmosis parasite is found in cat feces, soil where cats may have defecated, and in undercooked infected meat. Pregnant women should follow the safe handling recommendations for staying away from changing litter boxes and sand boxes and soil where you may find this bacteria. Alcohol during pregnancy. Alcohol consumption during pregnancy is one of the leading causes of preventable birth defects. Alcohol is a teratogen and is particularly damaging to the developing nervous system. It's also indirectly affects fetal growth and development because it's a toxin that reduces blood flow to the placenta, thereby decreasing the delivery of oxygen and nutrients to the fetus. Alcohol can also impair maternal nutritional status, further increasing risks to the fetus. We know that prenatal exposure to alcohol can cause a spectrum of disorders depending on the amount of alcohol consumed, the timing during which trimester, and the duration of the exposure. One of the most severe outcomes of alcohol use during pregnancy is delivering a baby with fetal alcohol syndrome, or FAS. Not what fetal alcohol syndrome is. It's a characteristic group of physical and mental abnormalities in infants resulting from this consumption, excess consumption of alcohol during pregnancy. Here is a picture. Here's some of the facial characteristics shared by children with fetal alcohol syndrome, including a low nasal bridge, short nose, distinct eyelids, and a thin upper lip. Newborns born with this may be shaky and irritable with poor muscle tone. Other problems are heart and urinary tract defects, impaired vision and hearing, and delayed language development. Also, below average intellectual function is the most common and most serious effect of fetal alcohol syndrome. Cigarette smoking is a teratogen in that it damages the nervous system and it reduces the amount of oxygen and nutrients delivered to the fetus. And we see with smoking mothers reduced birth weight, increased risks of stillbirth, preterm delivery, neurobehavioral problems, respiratory problems, early infant death or sudden infant death syndrome, or SIDS. And we know that secondhand smoke increases the risk of having a low birth weight baby when a pregnant partner is Drug use, you want to discuss all your medicines with a doctor. Pregnant women do. We know that marijuana and cocaine enter fetal blood, and cocaine reduces the delivery of oxygen and nutrients to the fetus. It increases risk of miscarriage, fetal growth retardation, premature labor and delivery, low birth weight, birth defects. We also know that cocaine and other illegal drugs before birth affect infant behavior, and affect childhood learning and attention span. Okay, so this section we're going to start with lactation. So we're going to talk about the events that trigger milk production and letdown, energy and water needs of lactating women, and the micronutrient needs of lactating women and versus those of non-pregnant, non-lactating women. So what is lactation? We know that there is a need for many nutrients, or even greater during lactation than during pregnancy, for the mother. The milk produced by breastfeeding mother has to meet all the nutritional needs of her baby, who is bigger and more active than they were in the womb. And to meet these needs, a lactating mother needs a variety of nutrient-dense foods. And the My Plate Daily Food Plan has breastfeeding information for women. So let's first talk about what lactation is. So lactation involves both the synthesis of milk components, the proteins, lactose, and lipids, and then also the movement of these components through the milk ducts to the nipples. So milk production and letdown are triggered by hormones that are released in response to the infant suckling. The pituitary hormone prolactin stimulates milk production, and the more the infant suckles, the more milk is produced. The term letdown, which is the release of milk from the milk-producing glands and its movement through the ducts and the storage sinuses, is caused by oxytocin. That's another pituitary hormone, and oxytocin release is also stimulated by suckling. But we know that as nursing becomes routine, oxytocin release and letdown may occur in response to just the sight or sound of an infant, and letdown can be inhibited or stopped by nervous tension, fatigue, or embarrassment. And we know that letdown is essential for breastfeeding and makes suckling easier for the child, so sometimes slow letdown can make feeding difficult. Here is a diagram or the anatomy of milk production, and we know that throughout pregnancy, hormones are preparing the breast for lactation by stimulating the enlargement and the development of the milk ducts and milk-producing glands called the alveoli, or singular alveolus. And during lactation, milk travels from the alveoli through the ducts to the milk storage sinuses and then to the nipple. Nutrition during lactation. Human milk contains about 70 calories per 100 milliliters, or about 160 calories a cup. And during the first 6 months of lactation, an average infant consumes between 600 and 900 milliliters a day, or about 2.5 to 4 cups a day. So about 500 calories are required from the mother each day. And much of this energy comes from the diet, but some can come from maternal fat stores. Because some of the energy for milk production comes from fat stores, the increase in recommended energy intake is lower during lactation, during pregnancy, because it's okay for the mother to use her fat stores, even though the total energy demands are greater. An additional 330 calories a day above the non-pregnant, non-lactating needs are recommended during the first 6 months of lactation for the mother. An additional 400 calories a day are recommended for the second 6 months. And we know that rapid weight loss is not recommended during lactation, so all those movie stars losing all their pre-pregnancy weight, is not great because it can decrease milk production. Protein, the RDA is still increased by 25 grams a day, and we know that higher intakes of total carbohydrate, fiber, essential fatty acids, and several of the vitamins and minerals are similar to that of pregnancy. Water, we know we need a lot more water a day to avoid dehydration and ensure adequate milk production. So lactating women actually need to consume about a liter a day of additional water, and they can consume this with extra glass of milk, juice, or water in each meal, and whenever the infant nurses, if they drink, that can help ensure adequate fluid intake. The recommendations for several of the vitamins and minerals are increased during lactation to meet the needs for milk production and to replace nutrients secreted in the milk. And for some nutrients, like some of the B vitamins, A, D, selenium, iodine, low maternal intake reduces the amount secreted in the milk, so that can become an issue. So low B12, like in vegan mothers who are not careful, can result in low levels of B12 in their milk. But other nutrients like folate, calcium, iron, copper, zinc, those levels in the milk are maintained at the expense of maternal stores, so it's just pulled from the mother. And here is the comparison of a lactating mother to a non-pregnant mother and recommendations. And this is a review of what we were just kind of talking about, and comparing the vitamin and mineral recommendations for a 25-year-old non-pregnant woman to a 25-year-old woman from the third trimester through 6 months of lactation. Okay, and we're going to end here. Well, maybe I'll go ahead and continue. Nutrition for the infant. So this is the last section. So after the umbilical cord is cut, a newborn mother must actively obtain and now we've moved from the mother to the baby, and that's why I kind of wanted to stop, but I'll keep going. But what we're going to talk about is how the newborn, what they need, how they obtain nutrients, since they're not getting it from the mother through the placenta, and how much they need for growth and development based on their activity level. So during infancy, we really consider that the first year of life. Growth and development are extraordinarily rapid, and growth is the best indicator of adequate nutrition in an infant. And we know that their birth weight should double by 4 months and triple by a year, and most infants increase length by at least 50% in that first year. Growth charts, you really need to understand what a growth chart is. They compare the weight, length, or head circumference to populations, and there's either a ranking or a percentile, and it indicates where the infant grows, how their growth is in relation to population standards. So here is a picture of a growth chart comparing the length and weight at a particular age to standards for optimal growth. There's one for boys and one for girls, and this is how we compare their growth. So not following the established growth curve, or if an infant is not growing, or there's a sudden change in growth patterns, that can indicate either overnutrition or undernutrition, and we can see increases in risk of obesity, diabetes, high blood pressure, harmful blood lipids, and cardiovascular disease in those infants really suddenly changing or growing off the growth curves. A common thing that comes up in this population for growth that is slower than the predicted pattern indicates failure to thrive, and that's caused by biological or psychosocial problems. And it's a catch-all term for any type of growth failure in a young child, and it